I grew up in athletics and sports, competitive, basically all my life. That led up to the problems I had with my shoulder to begin with. I had 3 prior procedures, including a partial reconstruction. All of those things contribute to the final analysis, which is repair. I didn't really know what to expect, but I was just hoping to be pain-free.
The surgeon makes an incision in the front or anterior part of the shoulder and moves the muscles and major blood vessels to the side. The part of the rotator cuff tendon in the front of the shoulder is removed, allowing entry into the shoulder joint, where the surgeon can view the surfaces of the joint. The ball portion of the humeral head is removed with a bone saw, and the hollow inside of the upper humerus or arm bone is prepared using a special rasp to allow the humeral component to be inserted. The metal stem is attached to the ball portion of the artificial shoulder. The socket is then prepared by removing any remaining surface cartilage. Holes are drilled in the glenoid for the stem of the glenoid component to be inserted and then cemented in place. The artificial shoulder is then inserted, and the shoulder is tested to make sure the pieces fit properly. The rotator cuff tendon is repaired, the muscles put back in place, and the skin is sutured together.
Patients are typically in the hospital for 2 days. They remain in the hospital after the day of surgery in order to manage their pain, and usually it takes them another day to become comfortable to get out of bed and get used to their arm in a sling and learn how to manage to dress themselves and simply get around.
I was shocked because I had no pain. No pain. It becomes more and more of a miracle as you progress and you see that you're not in any pain.
What I think is interesting about shoulder replacement is that many patients have significant preoperative pain, and by resurfacing the joint, we can provide relatively immediate pain relief for some of these patients. In fact, it's not uncommon for some of our patients to say they've had literally little to no pain after surgery, and I think that's a product of where they've started with because their pain was so severe preoperatively.
About 98% of patients will be very happy with the outcome of their surgery. They feel that their surgery has given them a shoulder that's at least 80% of normal, and many of them feel it's absolutely normal. Even though that's the case, about 2% of individuals may have a complication, even though all the steps are taken to avoid these complications. It's very important to discuss this with your surgeon prior to proceeding with surgery, so you're fully aware of the risks associated with what is generally an extremely successful operation.